everyone, welcome to our channel, Dr. B and Mary. My name is Mary. I'm an occupational therapist here in Austin, Texas, and with me I have Dr. Bertelson.
Hey there, Dr. John Bertelson, a neurologist also here in Austin, and we're really excited to be here today to start the first of hopefully many videos about our passion, which is caring for people with Alzheimer's and other forms of dementia. I found over the years that many people really have a lot of questions when they come into my office about Alzheimer's, dementia, other memory disorders, and we thought this would be a great opportunity to be able to help share our experiences with you and hopefully make it a little easier for you to know what to do if you see these memory problems in your loved ones.
We were thinking we would introduce ourselves, tell you a little bit about us and our experience and what we do. Dr. B, do you want to start?
Sure. So I've been in Austin as a neurologist for about 18 years now. And before that, I was originally from Houston. I traveled all over the world growing up in Southeast Asia, and finally ended up back in Texas, where I was briefly an engineer before going to medical school and then ending up in memory disorders. I did a fellowship in behavioral neurology in Boston before arriving here in Austin.
Oh, so cool.
Mary, can you tell us a little bit about yourself?
Yeah, so my name's Mary. I'm an occupational therapist here in Austin, Texas. I am from New Orleans originally, but we've been in Austin for about 6 years now. I have my own consulting company that specializes in dementia care called Your Dementia Therapist. And this is really focused on caregiver education, tackling those difficult day-to-day situations that arise, and helping the caregiver and also the family member really help care for their loved one who is living with dementia.
Oh, great.
Yeah.
Now, can we consider yourself a Texan now? You've been here for 6 years.
Yes.
Is that,
I consider myself a Texan now.
great to hear. So I think we can continue with this series now.
Yes.
So I thought we might just jump into one of or some of the more common questions that I get in my practice. I found over the years that patients and families might come in and say, "Well, I have Alzheimer's, but I don't have dementia," or they may say, "Well, my doctor said I have dementia, but at least I don't have Alzheimer's disease." And as we know, as you and I know, that it's often people have both. And so I thought we would talk a little bit today about some of the differences and just what some of these terms mean.
Yes. I'm glad we're starting off with this because I feel like a common question is, what is Alzheimer's? What is dementia? Is it the same thing?
Right. So dementia is a symptom. So when we use the term dementia, we are thinking that someone has enough of a change in their thinking to where they have had to give up certain activities of their what we call daily living. So their thinking problems are preventing them from driving safely, from continuing to manage their finances, from being able to live alone independently. Sometimes it's tricky to figure that out though, because if someone has a visual problem, if someone has a physical limitation, but their thinking is still pretty good, we don't use the term dementia if the limitations are due to things other than their cognitive disorders. But really dementia, again, is a symptom of significant change in someone's thinking. A milder stage of that is what we call mild cognitive impairment, or MCI. I tell patients that been around for a while, like the phone company from a long time ago, MCI. But in any event, mild cognitive impairment, or MCI, is similar to dementia, except that people with MCI have not had to give up certain activities. They can still drive, shop, manage finances, still do the things they used to be able to do. It may be harder. They may need notes and lists and a little bit of help, but they can pretty much do what they have to do.
And so whenever you're referring to MCI, so is this dementia or is this kind of like the precursor to dementia? Tell us a little bit more about that, because I know some people might have questions on exactly what this is in relation to dementia.
That's a great question. So we think of changes in thinking along a spectrum, along a continuum. As we get older, it's very common to have what we call subjective memory complaints. We say, where did I put my shoes? Where are my keys? Where's this? Where's that? Now, much of this is very common. Yeah. And many times, these symptoms are more bothersome to patients than people around them. And so that's why we call it subjective, meaning it's not really that obvious to other people. But if things get worse, if memory gets worse, then we think of mild cognitive impairment. And that's when there's a measurable change in thinking. Coming to the doctor's office, we ask memory questions, and we can tell, okay, this is not just normal aging. This is something more severe. And then sometimes if this is due to a disease that we'll talk about later, if things get even worse, where people start having to give up their activities, then we call that dementia. Gotcha. So oftentimes we go from normal aging to mild cognitive impairment to dementia, but not everyone goes along that path.
Thank you so much for your introduction to those terms. I think it's really important to kind of distinguish between normal aging, mild cognitive impairment, dementia, because I know a lot of people have questions on each of those terms. So that was a great introduction, Dr. Bertelson.
Oh, thank you. Yeah, these are very common, and I think that a lot of people out there didn't know the difference, and so hopefully this helps a little bit for patients and in particular family members. A lot of my patients don't realize they have a memory problem. I use a saying that many people forget how forgetful they are, and so we really do rely on family members to bring their loved ones to their doctor if they have a concern about their thinking.
So if people are having problems with their thinking or memory, what do you suggest, Dr. Bertelson? What would be the next step?
So I would talk to your primary care doctor. Many times memory problems are not due to Alzheimer's or other forms of dementia. Many times memory problems are due to depression or sleep impairment. Sleep apnea is a very common problem. Hormone disorders, thyroid problems, uncontrolled diabetes. So it's really important to see your doctor to make sure there aren't some of these more concerning medical problems going on. And then the doctor might refer the patient to a neurologist for further questions and further diagnostic help.
That's great to know. Yeah. Thank you all so much for tuning in to our first episode with Dr. B and Mary. We hope that it was informative and hope you all learned something today.
Thank you. I look forward to seeing you the next time.